Evening, guys. Hope I'm audible. Yes, fine. Fine. So, hope I'm audible. So, this is Farre Series, a third prof exams. Uh, Yesterday, we discussed on epidemiology, vaccines, and cold chain. Am I audible, guys? Today, we will start, guys. Okay. So, today, we will see the other topics. Okay, we will see the other areas we will cover here. The concept of health and disease, screening, and health communication. Okay, these are three small topics. Okay, you will get MCQs. You will get short notes. Okay, occasionally you'll get essay also from these topics. First, we will start here with concept of health and disease. We will start now. These are the topics which we are going to cover today. Concept of health and disease, screening, and health communication. Okay, fine. Purely for university exams, guys. University exams. Okay. Now, the first question here is, let's start here with, what is this human development index? Okay, so human development index. Okay. So Russia say MBBS karna sahi rahega sir. Whatever you are doing, you have to study. You study, be good. Now, so both measures what? This comes as short note for you. Both measures what? Both measures quality of life. Okay, quality of life. Human development index as well as PQLI both measures quality of life. Okay, so we can use it for countries, states, like that we can use. First is, what is PQLI? Physical quality of life index. Physical quality of life index. We can use it for countries, states. We can use it to compare what is the quality of life. It is made up of three parameters. First one is infant mortality rate. Second is literacy rate. Third is life expectancy at the age of 1 year. Okay, that is PQLI, is physical quality of life index, infant mortality rate, literacy rate, life expectancy at the age of 1 year. So for countries, okay, in between states we can compare. Okay, so various states, Maharashtra, Karnataka, okay, Haryana, like that we can compare. The scale is between 0 to 100, guys. But 0 means worst performance, 100 means best performance. Okay, best. Okay, but according to PQLA, what is not included here is no income, guys. Okay, some states, okay, we can compare. No income. No income is not part of this. This is physical quality of life index. What about HDI, Human Development Index? Human Development Index. Okay, fine. This is made up of three parameters. This is, the first one is life expectancy at birth. Life expectancy at birth. Second is per capita income. Okay, per capita income. You are comparing the income, per capita income. Third is, you are using knowledge in terms of, comparing knowledge in terms of mean years of schooling. Second is expected years of school. We are including both, guys. Okay? Knowledge in terms of mean years of schooling and expected years of schooling. This is Human Development Index. This is HDA, Human Development Index. Mean years of schooling and expected years of schooling. Now, so some countries are taken as standard. Based on this, we will categorize. Okay. So which country is taken as standard? Sometimes we have for whenever we are doing calculation, we take standards. For example, life expectancy. Japan is considered as standard. They are having the highest life expectancy, that is taken as standards. Per capita income, we take Qatar as standard. Okay, so combining these two things, okay, these three things, we will calculate the score. The score is between 0 to 1, guys. HDA score is between 0 to 1, but 0 is the worst performance, 100 is the best performance. So countries are categorized like this. Okay, we can use it for countries. Less than 0.55, that means low HDA countries. The quality of life is much lower here, less than 0.55. 0.56 to 0.69, that is medium HDA countries. Medium HDA countries, 7 more than or equal to 0.7, 0.7 to 0.79. This is high HDA countries, greater than 0.8. Okay, that means equal to greater than 0.8, very high HDA countries. Okay, HDA levels are much higher, very high HDA countries. Okay, fine. The score is between 0 to 1, guys. Okay, India will come in where? Okay, the value for India is value is around 0.645. So India will come here, guys. Okay, India comes in medium HDA countries. Okay, this can be asked as a short note, guys. Okay, Human Development Index. What is the other one? Okay, Human Development Index, as well as we have this PQLA, physical quality of. This is the first short note we have seen. Next, the next question. Explain the natural history of disease. Okay, this can be asked as a short note separately, or it can be asked as a part of the long essay. It can be asked. Essay also it can be asked. Explain the natural history of disease. Okay, are you guys able to follow? Yes or no? So, natural history of disease, it can be asked as a short note, or it can be asked as a part of essay also it can be asked. What is natural history of disease? What is natural history of disease? Natural history of disease refers to progress of a disease in an individual over time in the absence of intervention. Okay, how the disease starts. Okay, so over a period of time without any treatment, without any intervention, okay, fine, without any medical intervention. It may go for either recovery, disability, or death. It can go for either recovery, disability, or death. Without medical intervention, the process ends. Okay? How the disease starts, intervention. In the absence of intervention. If the question being asked, okay, so you have to draw this picture, at least the first half. Okay? So at least this one you should able to do it. So there are two phases are there. What is that is period of pre-pathogenesis. Period of pre-pathogenesis means this is before disease onset. This is period of pathogenesis. This is after disease onset. So before disease onset, that is period of pre-pathogenesis. After disease onset, that is period of pathogenesis. Okay, fine. In the period of pre-pathogenesis, okay, so three factors are required. Okay, let us assume for a communicable disease. Suppose the question is TB or any communicable disease, three things are required. Okay, agent factors, host factors, and environmental factors. This is before disease onset. They interact together, okay, and they cause the disease here. they cause the disease. It goes like this. Okay? So early pathogenesis, then early lesions, advanced lesions, and finally it can go for out. That means, okay, the symptoms will start, signs and symptoms. Okay, then illness, disability, finally it may go for either recovery or death without any intervention. This we call it as, okay, this we call it as, okay, period of pre-pathogenesis and period of pathogen. This we call it as natural history of disease. Okay, without any intervention. Okay, how the disease starts, how it evolves over a period of time. Okay, fine. Now, these are the three things that is required. This is epidemiological triad for a disease, for a communicable disease to happen. This may not explain the non-communicable disease. Okay, it may be for it can do other things. Okay, agent factors are there. It may be biological, nutrient, okay, and human host, and third is environment. So there is interaction will happen at various levels and it can cause the disease. Now, these are the biological agents. Okay, it may be biological agents, nutritive agents, physical agents, chemical agents. Okay, it may be anything, guys. It may be anything. Okay, so this can act as a agent. Suppose for TB, if you take, okay, most likely a biological agent. Okay, suppose TB is this biological agent. Okay, fine. Mycobacterium tuberculosis. Okay, fine. So it may be anemia. It may be anemia, or PEM means it becomes nutritive agents. Nutritive agents. Okay, fine. These are the agents. These are the agents. Next. Okay, host factors. Okay, host factors that depends on various things. Okay, it may be due to certain diseases common in certain age, or it may be genetic factors. Maybe genetic factors. Okay, more for non-communicable disease, or lifestyle factors, socioeconomic status. These are the factors that can affect the occurrence of disease, guys. Okay, fine. This is host factors. And third is environment. Maybe physical environment, biological environment, or psychosocial. Okay, fine. So it may be living things, non-living things. Okay, microbial agents. Okay, lifestyle changes all can cause this. That is external to human environment. Okay, so am I clear? This is natural history of disease. That is how it starts, how it progresses over a period of time without intervention. So period of pre-pathogenesis is there, then period of pathogenesis is there. Okay, so agent factors, host factors, environmental factors, they can contribute to it. If this is a short note, you have to write this. Okay, fine. If they are asking very specifically TB, so you have to say that what are the agent factors, what are the host factors, what are the environmental factors can cause. Okay, overcrowding, poor ventilation, okay, lower socioeconomic status, all these things can be part of it. Describe the various levels of prevention and intervention with example. This is a essay question. This is a essay question. What are the different levels of prevention? Different levels of prevention. First is primordial prevention. What is primordial prevention? Prevention prior to onset of risk factor. That is primordial prevention. Prevention prior to onset of risk factors. Okay, before risk factors itself, if you want to start prevention, that is primordial prevention. What is primary prevention? Can you tell me what is primary prevention, guys? Can anyone tell me what is primary prevention? A various level. This is an essay question. What is primary prevention? Is prevention prior to onset of disease. That is, risk factors may be there, but what is not there is disease is not. That is primary prevention. Okay, fine. What is the next one? This is secondary prevention. What is secondary prevention? Secondary prevention means the disease have started, guys. Disease have started. You are trying to stop the disease at an early stage. What is secondary prevention? Secondary prevention means action that halts the progression of action that halts the progression of disease. That is, disease have started. You are trying to stop the disease at an early stage. Okay, fine. If the question being asked, you have to write everything, guys. Okay. So primordial before risk factors, primary before the onset of disease, secondary means action that halts the progression of disease. Third, what is tertiary prevention? Tertiary prevention. Tertiary prevention means measures taken to reduce disabilities. Okay, the already complications have gone. You are taking some measures to reduce disability. Secondary prevention we do in the patient's case. Okay, we do in the patients. Okay, fine. So this is different levels of prevention. Okay, fine. Now, how we are going to achieve this prevention? Okay, for that we are having this concept called as intervention. What is intervention? Intervention means any attempt to interrupt usual sequence of. As a doctor, we are all going to do this one. Any attempt interrupt the usual sequence of disease. You are trying to stop the disease, guys. Okay, that we call it as intervention. Okay, fine. So how many modes are there? That was the question. We should write it with example. We have 5 modes are there. So the first one is health promotion. Okay, health promotion. Okay, so health promotion, this comes in primary prevention. How you are going to promote health? Okay, you go there and teach children. Okay, you can do health education. This is primary prevention. You go there, children on hand washing techniques. Okay, so we can prevent fecal-oral disease. Second is environmental modification. Okay, there is some water stagnation is there. Okay, you are closing that water. Okay, that is called as environmental modification. What disease we can prevent is, we can prevent this vector-borne disease, we can prevent it. Third is nutritional intervention. We are providing food to the children, their immunity is getting better, less chance of disease. Okay, that comes in nutritional intervention. Okay, you are providing food to the children. Okay, the immunity is getting better. Okay, which program we are providing food to the children? Anyone? Is we are providing food to the children in what? Midday meals. Okay, midday meals we are providing. We are providing in Anganwadi, we are providing. Fourth one is lifestyle changes. Like lifestyle changes like weight reduction, okay, smoking cessation, weight reduction, smoking cessation. Okay, fine. Now, so am I clear? So these are the various health promotion. These are the various health promotion measures. This comes in primary prevention. Don't forget it. It is primary prevention. We are going to do it, guys. Fine. Next. Next is specific protection. The second one is specific protection. Okay, specific protection. Specific protection. This also comes in primary prevention. This is also specific protection. You are doing very specifically to prevent disease. One is vaccination. Vaccination. Chemoprophylaxis. Okay, vaccination. Chemoprophylaxis. Okay, fine. You are doing very specifically iodization of salt. Okay, iodization of salt. This also comes in which level of prevention? This also comes in which? Yes, it comes in primary level of prevention, specific protection. Okay, fine. Third one, early diagnosis and treatment. Early diagnosis and treatment. This comes in which level of prevention? Early diagnosis and treatment. Yes, early diagnosis and treatment. This comes in, okay, secondary level of prevention, guys. Okay, any screening tool, for example, pap smear, okay, acid fast bacilli. Any screening tool will come here. This comes in secondary level of prevention. Any screening tool. This comes in secondary level of prevention. Fourth one. Fourth one is disability limitation. Okay, disability limitation. You can go for disability limitation. So disability limitation, it goes like this. Okay, so normally it goes like this. Disease will come. Disease, impairment, disability. Finally, it can go for handicap. So normally it goes like this. Disease, impairment, disability, and handicap. Impairment means it may be anything, guys. Maybe anatomical structure, it may be loss of physiological or psychological function. Disability means, what is disability means? Not able to do a normal activity. That is disability. Handicap means not able to do a social role, guys. Social role. Okay, so this is disease, impairment, disability, and handicap. So social role. Okay, person lost leg. Okay, that becomes impairment. Since the person lost leg, he was not able to walk. Then it is disability. Okay, since not able to do normal walking is a normal thing, he was not able to do it, and because he is not able to walk, he is unemployed. For example, you can take like this: lost leg, not able to walk. So walking is a normal thing, and unemployed. Okay, unemployed. This is disability limitation. This comes in which level of prevention? This comes in tertiary level of prevention. This comes in tertiary level of prevention. Okay, so early diagnosis and treatment secondary level, and this one comes in tertiary level of prevention. Fifth one. Fifth one is rehabilitation, guys. Okay, rehabilitation. Okay, what is this rehabilitation? What is rehabilitation? Rehabilitation means, for example, medical rehabilitation. Okay, restoration of function. Okay, somebody lost leg. What you can do? You can provide a prosthetic leg. Okay, restoration of function. This is medical rehabilitation. Next is vocational rehabilitation. Vocational. Job training. You can provide job training to earn a livelihood. They can earn themselves. Job training. So these are rehabilitation. So this also comes in tertiary level of prevention. So health promotion, specific protection. Health promotion and specific protection, okay, comes in primary prevention. Early diagnosis and treatment, secondary prevention. And disability limitation, rehabilitation comes in tertiary prevention. This is an essay question. So hope this is clear. Shall I go to the next one, guys? Shall I go to the next one? This is for quick revision. Okay, fine. Classify the indicators of health. Enumerate mortality indicators and other indicators you can enumerate, guys. Okay, fine. This is also a essay question, guys. Okay, essay question. Let us see all the indicators. Okay, fine. Now, these are the classification of indicators. Maybe mortality indicators, morbidity, disability rates, nutritional status indicators, healthcare delivery indicators. It may be utilization of rates, These are some of the other indicators. Okay, indicators of social and mental health, environmental indicators, socio-economic. Okay, these are the various indicators. First, let us start here. What is mortality indicator? Mortality indicators means these are death indicators, crude death rate. Okay, so we will see. You would have seen. Okay, so even life expectancy is also a mortality indicator. Guys. Okay, life expectancy. Okay, crude death rate. Okay, number of deaths by mid-year population. Age specific death rates. Okay, age wise death rates. Infant mortality rate. Infant mortality means 0 to 1 years. Child death. Okay, infant mortality. Child death rate means 1 to 4 years. Okay, 1 to 4 years children death. Under 5 mortality. Okay, adult. Maternal mortality ratio. Disease specific. Proportional mortality rate. Case fatality. All are mortality indicators. Mortality means these are death indicators. Death indicators. What about morbidity indicators? What is morbidity indicators? So morbidity means disease, guys. Okay, incidence, prevalence, okay, notification rates in the hospital, attendance rates in the hospital. Okay, these are the months. Currently, we are in monsoon or winter months. Okay, now there will be more morbidity will be there in the community, guys. Okay, these are the morbidity indicators. Okay, how many cases? All the OPDs are full nowadays. Okay, the infections are very common now. So this is an indicator for morbidity indicators. These are morbidity indicators. What are disability indicators? The first one is DALI. What is DALI? DALI means disability adjusted life years. That is DALI. DALI means disability adjusted life years. It is disability adjusted life years. Okay, that is DALI. It includes, it says about disease burden. Okay, disease burden talks about years of life lost plus years of life lived with disability. Okay, years of life lost, it includes both, guys. This years of life lost is premature death. Okay, premature death, so it includes both years of life lost and years of life lived with disability. We'll see MCQs later on. Okay, so what is being asked? Okay, fine. This is disability indicators. First one is DALI. Okay, one DALI corresponds to non-communicable disease. Okay, for cardiovascular disease, DALIs will be very high. Okay, one DALI corresponds to 1 year of healthy life lost. That is DALI, guys. This is DALI. The second one is Sullivan's index. What is Sullivan's index is? This is life expectancy. This is life expectancy free of disability. Disability free life expectancy. Life expectancy free of disability. This is Sullivan's index. Third one. Okay, that is Hale. What is Hale is health adjusted life years. Health adjusted life expectancy. Okay, it's a type of prediction. You are trying to predict. What you are trying to predict here is life expectancy at birth. Life expectancy at birth, including time spent on poor health. Okay, so including the time, how much time you spent on poor health. Disability indicators. DALI can also come as short notes for you. Disability rates can be a short note. So life expectancy at birth, including time spent on poor health. The fourth one is QALY. QALY means quality adjusted life years. Quality adjusted life years. That is quality adjusted life years. Number of years of life added by intervention. Number of years of life added by intervention. How many extra years the person was able to live because of your treatment. That is quali. Okay, quali means number of years of life added by intervention. And these are the disability rates. The disability rates can also be a short note for you guys. What are the healthcare delivery indicators? These are certain norms. We are looking in the indicators of health, essay question. The healthcare delivery indicators, one is population ratio. A second example is population bed ratio. Okay, for how much population there should be, doctor should be there. Okay? What population bed should be available. So doctor population ratio, the norm says that we require one doctor for every 1,000 population. Okay, so 1 lakh population, what should be the bed? These are norms. These are healthcare delivery indicators. Just one example. Utilization rates. What is utilization rates? Okay, the service is available whether people are using it or not. Percentage of children. Okay, percentage of children fully vaccinated. Okay, percentage of children fully vaccinated. Percentage of antenatal mothers with 4 checkups. Okay, so what is the percentage of antenatal mothers with 4 checkups? Okay, minimum norm is 4 checkups. Percentage of antenatal mothers with 4 checkups. Okay. This is 4 checkups. Indicators of social and mental health in a particular area. What about social and mental health? Okay, this is, okay, we can say, what is the example? Homicide, suicide, okay, drug abuse. So we are looking into the indicators of health. Environmental indicators. What is the problem we are seeing in Delhi right now? Okay, that is an example for environment indicators. That is air pollution. Okay, water pollution. These are some of the environmental indicators regarding health. Socio-economic indicators. Levels of unemployment. Okay, levels of unemployment. Okay, levels of illiteracy. Okay, so what percentage of people are illiterate? Okay, illiterate. Okay, Farre, they are saying, guys, it will be available from in December, guys. Saying in December. Nirmal, it's available from December. Health policy indicators. Okay, what percentage of, okay, health policy indicators, what percentage of, okay, GDP, gross domestic product, spent on public health? Okay, so WHO says we have to spend at least 5%. Okay, so Indian government is spending around 2%. Okay, GDP means gross domestic product, guys. Gross domestic product. Okay, fine. What percentage of GDP spent on public health? Nutritional indicators. What are the nutritional indicators? Like anemia, prevalence of anemia, PEM, okay, iodine deficiency. These are the examples for nutritional status indicators. So this is the essay question. Okay, so these are the essay question we have seen. These are the various headings, guys. Okay, under the indicators for health. We'll go to the next question. What are the various determinants of health? Okay, so health, this is again a short note for you. Okay, various determinants of health. This, try to draw this picture because it's there in the textbook of Park. Okay, examiners will expect. Okay, one is biological, okay, behavioral, environmental, socio-economic. These are the various determinants are there. Let's see one by one, guys. First is biological determinants. Biological determinants means genetic factors. Okay, genetic factors, definitely it will affect your health, guys. Definitely. Okay, genetic factors, definitely it will affect your health. Okay, so whatever it may be. Okay, so whatever for non-communicable disease and other things, but these are the biological determinants. Second is behavior and socio-cultural conditions. Okay, we have this smoking is there. Okay, smoking, alcohol. Okay, alcohol. Okay, every set of people will have, every culture will have their own behavior. Okay, so smoking, alcohol, these are some of the examples for determinants that will affect the health, guys. Okay, fine. Behavior and socio-cultural condition. Third is what else can affect. Okay, what else can affect here is aging can affect. Aging population, especially developed countries. Okay, it will affect, yes, developed countries. Okay, aging population, it can affect health, developed countries. Health services. Okay, health services can affect health. Lack of health services, lack of health services. Okay, so for some areas, so if you take India itself, okay, so very rural areas, okay, if there is no facilities for health, definitely that will affect the health. Okay. Environmental factors. Environmental factors, this can affect health. Okay, so it may be physical environment, okay, or biological environment. Heat can affect you. Right now it's very cold. Okay, cold can affect your health. Okay, so microbial organisms can affect health. This is environmental factors. Next is socio-cultural factors, socio-economic factors. Okay, socio-economic factors, for example, low socio-economic status. Low socioeconomic status, more communicable disease is common. More communicable disease. Okay, so that will affect health. Low education. Okay, low education, that will also affect health. Okay, so it will affect health. Affect health. Fine. So these are the various factors, guys. These are the various determinants of health. Okay, so this is what we have seen. Okay, so it may be biological, environmental, socio-economic, even health system, aging population, gender, more common in female. Okay, female compared to male, gender has a, okay, as an effect. Okay, certain diseases are more common because nutritional diseases are more common. Anemia is more common in females. Okay, so these are the various determinants of health, guys. Various determinants of health. We'll go to the next question, guys. What is the difference between elimination and eradication? This is a short note for you. Okay, we'll finish the first chapter. Okay, what is elimination? What is eradication? Eradication means extermination of infectious agent. Okay. Eradication means extermination of infectious agent. Eradication means extermination of infectious agent. It's at global level, guys. It's at global level. A global level. Only one disease we have eradicated. Can you tell me what is the disease we have eradicated? Okay, only one disease we have eradicated. What is that? It is smallpox. Smallpox. Okay, one disease we have eradication. What is elimination means what? What is elimination? Elimination means, okay, elimination means interruption of chain of transmission. Interruption of chain of transmission. Can you tell me what are the disease we have eliminated in India? Interruption of chain of transmission. Yes, guys, can you tell me what are the disease we have eliminated in India? Interruption of chain of transmission. In India, this comes at regional level. Recently also we had one disease where there. Okay, what are the disease we have eliminated in India recently? Not polio, we cannot say polio. What are the other things? Okay, we have this leprosy, yas, guinea worm. Recently it was there in news, guinea worm. Okay, two more is there. What is the other one? Trachoma. Trachoma. Okay, neonatal tetanus, guys. Neonatal tetanus. These are the disease we have eliminated. Okay, fine. So we have this difference between elimination and eradication, guys. And this is a short note for you. Okay, so elimination is there at regional level. Eradication is there at what? Eradication is at global level, guys. Okay, eradication should be there at global level. Fine. Explain this iceberg phenomena with an example, guys. So this is again a short note for you. Okay, fine. What is this iceberg phenomenon? You are comparing disease in community, okay, with iceberg. You are comparing disease in a community with iceberg. For example, iceberg will be looking like this. The iceberg will be looking like this. So what we see, okay, so this, let us assume this is the iceberg. This is the iceberg. What does this tip represents? What? The tip represents, these are symptomatic cases, okay, which we see in the hospitals, guys. Symptomatic cases. These are asymptomatic cases. Asymptomatic cases. Understand? The entire iceberg is diseased people. What we see in the hospital is just only a tip. There's a huge amount of hidden portion is there. Huge amount of hidden portion is there. Okay, this entire iceberg is disease. Huge amount of hidden portion is there in the community. For example, diabetes, hypertension. Okay, all these non-communicable disease, diabetes, hypertension. Okay, most of the times they may be asymptomatic. Okay, there is a huge. You are seeing very less case in the community, in the hospital. Hypertension. That means there's huge amount of cases there in the community. For influenza also, any flu. Which condition will not show iceberg phenomenon? No iceberg. What is this line of demarcation? This is the line of demarcation. I have some 15 MCQs there in the end, guys. We'll discuss it. This is the line of demarcation between apparent and inapparent illness. Okay, apparent and inapparent illness. This is a line of demarcation. Which condition? No iceberg phenomena. That means always it is symptomatic. There is no asymptomatic cases or not. That's always symptomatic. Can you tell me which condition? No iceberg phenomena. Can you tell me? No iceberg. Yes, guys, no iceberg. Which condition? No iceberg phenomena. Which condition? Yes, it is measles, tetanus. This question being asked, you're supposed to draw the diagram, guys. Okay, no iceberg phenomena. Measles, tetanus, and rabies. Okay, fine. RNA, good. Okay, answering is correct. Rabies, no iceberg phenomenon. That means there is no asymptomatic cases. Asymptomatic case. Okay, fine. It's always symptomatic. Now, so this is concept of health and disease. We have seen certain questions we have seen. Okay, next we'll go to the next chapter, guys. That is screening. Chapter screening. Mostly what you will get is short notes. Okay. Very rarely you may get a essay. Mostly short notes. What is the difference between a screening test and a diagnostic test? We'll take the example. Let's see it. A screening test and a diagnostic test. I will take the same condition. A screening test, pap smear. A diagnostic test we can look for is a biopsy. If a cervical cancer, biopsy. Screening test is done on healthy people. Screening test, any screening test, okay, more than 35 years. Female coming to OG department, let us screen them, okay, for cervical cancer. So you are looking healthy people, you will do the screening test. What about diagnostic test? Diagnostic test usually done on sick people. Screening test is usually applied on groups. You don't do it on a single person more than 35 years. Okay, you do it on groups. Diagnostic test is done on a single patient. The test results are arbitrary and final, that is approximate only screening test. Either it's positive or negative. A diagnostic test, it will be modified based on the light of evidence case. Okay, so that is the diagnostic test. Screening diagnostic test is based on one cutoff point. Screening test, okay, various other modalities for a diagnostic test. Screening test is one cutoff point. Screening test is less accurate and less expensive. Diagnostic test is more accurate and more may not be available all the times. Okay, so biopsy is very difficult to do it. Screening test is not a basis for treatment. Even if screening test is positive, what you are supposed to do? You have to confirm it with a biopsy. So pap smear is positive, confirm it with biopsy. This one is used as a basis for treatment. As a basis for treatment. Initiative for screening tests comes from the investigator. Investigator will say, okay, more than 30 years, OG department they are saying, or any other department. Okay, so let's screen people. Initiative for a diagnostic test from patient. Patient is saying that I have some problem. Okay, please find what is the problem. I have some issues are there. Please find what is the issue. The initiative is from the patient. How will you measure the validity of a screening test? Okay, validity of a screening test. Validity of a screening test. What is validity? Validity means accuracy. Accuracy. Validity is measured by two components. It is measured. Validity. One is sensitivity. Sensitivity. What is sensitivity means what? Sensitivity means ability of the screening test to identify true positive. That is sensitivity. Okay, that means ability of the test to identify true positives. Who is true positives? True positives means they are diseased people. Diseased people. The ability of the pap smear, for example, to identify diseased people. Okay, fine. Sensitivity is 90%. What do you mean by that? If 100 diseased people are there, this test can identify how many people? 90% from. Okay, sensitivity 90% means 100 diseased persons are there. It will correctly able to identify 90 people. Okay, this is sensitivity. Ability of the test. So what is the formula? The formula is numerator is true positives. What is the denominator? That is diseased people. Diseased. Okay, multiplied by 100. Okay, so who is diseased? Diseased means that is true positives plus false negative. They are diseased people. So ability of the test to identify true positive. What is specificity? What is specificity? Specificity means ability of the test to identify true negatives. True negatives. Who is true negatives? Who is true negatives? True negatives means they are non-diseased people. Okay, non-diseased people. This is true negatives, non-diseased. Okay, so specificity means ability of the test to identify true negatives. True negatives means who are they? Non-diseased people. Okay, non-diseased. For example, let's make a 2 by 2 table. Okay, so you are going to take diseased here, non-diseased here. Okay, so you are taking diagnostic test, the x-axis, screening test in the y-axis. Positive, positive and negative. So this is screening test and diagnostic test. Both are positive guys. Screening test is also positive. That means it is true positive, right? Both are negatives. This is true negatives. But the patient is non-diseased, but screening test is positive. This is false positives. Patient is diseased person, but screening test is negative. This is false negative. This is false negative. Already I told you what is the formula for sensitivity. Sensitivity is true positives by disease. These are diseased people. These are diseased. These are non-diseased. Okay, so true positives by diseased people. So what does it mean? True positives plus false negatives multiplied by 100. This group. This group. This is sensitivity. What about specificity? True negatives by non-disease. Who is non-disease? True negatives plus false positives multiplied by 100. It goes this way. Okay, so this is specificity. These are the two things that will measure the validity of the test. Validity of the test is measured by one is sensitivity, another one is specificity. Okay, you have to write the statement. Also the formula you have to write, guys. Formula you have to write. What are the types of screening, guys? What are the types of screening? So screening, we have three types of that. Again, this is a short note for you. One is mass screening. I am writing crisply. What is mass screening? Mass screening means you are going to screen everyone. Screen each and everyone. Okay, that is mass screen. Suppose a village is there, you want to screen people. Okay, for diabetes, you are going to screen each and every person in the village. That is mass screen. Second is high risk screening. High risk or selective screening, as recently in INICT exam, guys. High risk screening or selective screening. You are going to screen high risk people. Screen high risk. You are going to screen high risk. Who is a high risk? Who is a high risk for diabetes? Okay, family history is there. Okay, obesity is there. Okay, so that we are going to call it as high risk. Screen high risk population. Family history more than 35 years. Okay, obesity is there. Okay, sedentary lifestyle. These are called as high risk population. Third one is okay, multiphasic screening. Multiphasic screening using multiple tests to screen. Okay, you are going to use multiple tests. You are going to use multiple tests to screen. Example is master health checkup. Example is master health checkup. Okay, so using multiple tests, you are going to use multiple tests. Okay, fine. So high risk screening, multiphasic screening, and using multiple tests, ECG, echo, okay, blood test, everything. Okay, fine. Which is the best one here is okay. This select high risk screen. This is the best one, guys. Yield is very high. Okay, so the amount of positive cases, okay, for the money you are investing, that will be much higher. Multiphasic screening, that is not good, guys. Multiphasic screening, that is not good. What is this lead time? In this is a short note for you. What do you mean by lead time? Okay, so in the natural history of disease, it goes like this. Disease set, first possible point of detection. Okay, first possible point of detection. This is the usual time of diagnosis. Usual time of diagnosis means which test will you use? Screening test or a diagnostic test? Usual time of diagnosis, which test will you use? Okay, you will be using diagnostic. This is the outcome. It may be recovery or it may be. So this time, the time between first possible point and usual time, this we call it as lead time. This we call it as lead time. The time between the first possible point of detection and usual time of diagnosis. Now, what is there? Maybe another time may be there. For example, final critical point. A final critical point of diagnosis. Even if you make diagnosis after this, that's not going to change the outcome. For example, uh, cancers. Okay, for cancer, we may have metastasis. Metastasis may act as a final critical point. Metastasis has happened. That is very difficult to change the outcome. Okay, so what is this time period? This time period is called as screening time. First possible point and usual time, that is called as lead time. First possible point and final critical point, that we call it as screening time. So are we clear, guys? Go to the next chapter, guys. Health communication. I think it's going okay. Are you guys able to follow? Next question. Define health education. Discuss in detail various approaches for health education and principles for health education. This is a essay question. This is a essay question for you. So what is this health education? Health education is a process aimed at encouraging people who want to be healthy, to know how to stay healthy, what they do individually and collectively to maintain health care, okay, when needed. Okay, fine. Kana Kaliye Apte. Okay. Anyway, we'll finish in another 20 minutes. We'll finish, guys. After that, I can have dinner. So, this is a process aimed at encouraging people who want to be healthy to know how to stay healthy, what they do. So, that means you're providing some information to the people, that we are going to say that health education. Health education, what are the approaches we have? Approaches. The first one is regulatory approach. Government, even though it's a good thing, people are not doing it, and government is forcing us to do it. For example, seat belts, helmets, helmets. Okay? The Child Marriage Restraint Act. Okay? Child, even though it's a good thing, okay, people are not following. That is regulatory approach. Government is forcing us to do it. One of the famous example is that, okay, in 1976, government thought the population was increasing. So government decided that let's go for vasectomy for the males who completed the families. Okay, as an endorsement they did. Okay, and the sterilization campaign failed, and that is one of the reason that government lost the election 1977. One of the reason. That's not the reason. Even though it's a good thing, if you put it on people, people won't follow. That is a regulatory approach, guys. Second, service approach. A service approach. Provide services at doorstep, guys. Services at doorstep. For example, government thought that in rural India, people are going for open air defecation. Let us construct toilets rural areas. Do you think people used it? This is also failure mode. Even though it's a good thing, you are providing at their doorstep also, people don't follow it because it is not based on their felt needs. Not based on their felt needs. This is also failure. This is also failure. Not based on the felt needs. This is service approach. The third one is different approaches we have. Health education approach. Okay, health education approach. Okay, so you are providing health education. Okay, for example, using charts and other things. Okay, so you are doing a planned learning experience. As a doctor, probably during a UG time or an internship, you will be doing this. Okay, planned learning experience. You prepare facts and you prepare content, you prepare charts, and you will explain it to the people so that they can follow it. So this model, it will work little bit. Okay, so but on a long term it may not work, but work. Okay, so you go there, teach them. As a doctor we do it, health education approach. The fourth one is primary care approach. Okay, fourth one is primary care approach. What is primary care approach? Is let the people plan for themselves. Planning for themselves. Let them plan themselves. Okay, so we have Asha is there. We have one committee will be there. Okay, in NRHM, the committee is called as Village Health Sanitation Nutrition Committee. Guys. Okay, they will be involved in planning for themselves. Okay, so village health planning they will be doing. Okay, so they will do what is for their village. Okay, what is needed. People will plan among themselves. Okay, this we call it as primary care approach. Out of all, this is the best one. Out of all, this is the best one. So health education approach, primary care approach, service approach, and regulatory approach. This is the best one. Best one. What are the principles of health education? Okay, now when you are providing health education, make sure that whatever information you are given, that is credible information. Credible means it should be based on scientific facts. Okay, don't say things which is not at all scientifically true. Create interest. Okay, when you are providing health education, you have to create interest. Okay, fine. Make sure that audience participate in it. Okay, you create interest. Make sure that audience participate in it. Okay, motivation, you motivate them. Okay, either positive side or negative side. Okay, so somewhat you have to motivate them whenever you are providing health education. Comprehension means, okay, in a village you are going to talk in English, means how they will understand. Okay, so you have to tell it in a way that they will understand. Okay, make sure that they understand what you are saying. That is comprehension. Reinforcement means repeat it. It's single thing people may not remember. Okay, so you have to repeat it. Learning by doing, you do. Okay, known to unknown. Straight away don't teach things which they don't know. Okay, start from what they know. From that you can go for unknown area. Setting up the example. For example, okay, you are talking regarding smoking. As a health educator, you are going there and telling them, okay, please avoid smoking, and all you are telling. Okay? At the end of the session, okay, you go there, and if you are smoking, okay, do you think people will follow you? That what happens. No, that is wrong. Good human relationship. Maintain good human relationship. Okay, get feedbacks. Okay, so that you can improve the health education. Get feedback. That's why leaders use leaders. Okay, that's why what? Okay, who comes for cancer, oral cancer? Who comes? Cricketers comes. Okay, actors will come. Known people. Use them. Okay, those are having face value. Known people. Okay, use them. Okay, these people are having face value. So include them whenever you are providing this health education. So keep these things in mind. These are the principles, guys. Okay, so leaders. Okay, setting up as an example, known to unknown, comprehension. Okay, motivate them, credibility, and interest you create. Fine. This is also a short note, or it can come as a essay question also. Discuss the various methods in health communication. Discuss the various methods in health communication. So these are the various methods, otherwise. These are the various methods. One, it may be an individual approach for health communication, or a group approach. As a doctor, we also will be part of this, or a mass approach, right? Okay, individual approach means you are going to talk to people individually. Individually, you are going to talk to people, right? So that is individual approach. Okay, suppose personal contact, maybe a counseling you will be doing. Okay, counseling. This maybe you may be doing it. Okay, fine. This is individual approach. Mass approach. Okay, you want to tell lot of people. What will you doing? Okay, for family planning or something you want to talk individually, yes, you can do counseling, guys. That is individual approach. Mass approach, you want to talk to lot of people. Okay, huge set of people, you want to pass on the information. Okay, what is the easiest way? Yes, easiest way is TV, radio. Okay, lot of people you can do it. Direct mailing you can do, internet is available, newspaper ads you can give. This will reach the lot of people. Okay, fine. That is mass approach. What we can do at group level? Group level means a particular group of people. Suppose you are there in the OPD. In the OPD you want to do something. Okay, so what are the various methods available? The first one is you can do lectures. Okay, you can do demonstration, guys. Okay, first one is demonstration as a group approach. The first one is, what is demonstration? Demonstration, whenever you want to teach a skill, you want to teach others how to prepare ORS. For example, ORS preparation. ORS preparation. Preparation of ORS. Then it is a demonstration. Which method will you prefer? Your teacher wants to teach you percussion. Lecture will be good or demonstration will be good? Auscultation. Okay, how to listen to a murmur. That is demonstration. Second, you can use group discussion as a method of health communication. As 6 to 12 members, they can sit and discuss, guys. Okay, 6 to 12 members, they can discuss on a topic. Okay, there may be a note taker, may be there may be a leader, may be there. Okay, and a timekeeper may be there. Okay, if the discussion happens properly, it's a very effective method of health communication. Okay, very effective method if the discussion happens. So everybody is discussing properly. A group discussion is a very effective method of health communication. Third, what is panel discussion? Okay. What is panel discussion? Discussion between experts, okay, in front of audience. A discussion between experts. Okay, so experts are discussing. Okay, fine. Okay, you would have seen in your college also. Okay, discussion between experts in front of audience. In front of audience. You are a neat aspirant. Okay, fine. Study well. All the best. Okay, discussion UG aspirant probably, I think. Okay, fine. PG is also, the others are also PG aspirant. Being UG aspirant, all the best, guys. So discussion between experts. Okay, so experts are discussing on a particular topic. As an audience, you can raise question. Fourth one. Okay, what is symposium? Symposium means series of lectures. A series of lectures by experts. For example, okay, one person you have attended it. Okay, so CME program, one person talks on clinical features. Okay, for a particular disease. Other person will talk on treatment. Other person on diagnosis. Okay, like the various ways they can do it. That we call it as symposium. Okay, as an audience, you can raise question. That is symposium. When we'll use role play, you can use role play as a method of group communication when audience is children. Audience is children and very sensitive topics are there, means you can go for it. I'm talking only salient points. Okay, sensitive topics. Okay, suppose you want to show to people on dowry deaths or something very sensitive topic. So that is better way we have this role play, we can do it. Sixth one, what is this workshop? Workshop means this is also for group communication, so you can go for hands-on training. A hands-on training, hands-on training. A BLS workshop, basic life support workshop. Basic life support workshop, suture workshop, okay, advanced life support workshop. These are the methods of group communication. It can be as a short note, guys. Okay, so health communication, individual level, group level, and mass level. Next, I think probably this is the last question. What are the barriers of communication? This is again short note. Okay, so what are the barriers of communication? Then we have MCQs, guys. These are the various barriers. It may be physiological barriers. Okay, so you want to talk to people, okay, regarding communicate with the people, and physiological, okay, the difficulty in hearing is there, then it's difficult for you. Okay, hard of hearing is the opposite person is having hard of hearing, it will be difficult. Level psychological, levels of intelligence, comprehension difficulties, psychological, then it is again it's difficult. Environmental, noisy area, congested places, it's very difficult to communicate. So in a private place you can talk easily, but rather in a traffic prone areas it's very difficult to communicate. OPD areas is very difficult. Sometimes your teacher, most of the times you may not able to hear also. In clinical posting, okay, when it is very noisy, it's very difficult. Fine. Cultural levels, okay, illiteracy, okay, customs, beliefs, attitudes, okay, all these things can affect the, okay, health communication. It's very difficult to communicate. Okay, 25-30 year person is easy to communicate. If you want to communicate to 60-70-year-old person, it's very difficult because hard of hearing will be there. Okay, levels of intelligence will be a problem, their comprehension will be a problem, and they will have their own customs and beliefs will be there. Okay, these are the various barriers, okay, for communication. So we completed 3 topics: concept of health and disease, training. We are discussing questions, guys. Question, okay. The objective is that questions, okay, university exam questions, and now we will see some university MCQs that has been asked. Since MCQ is part of your curriculum now, okay, try to answer this, guys. Try to answer this. Vitamin A prophylaxis to a child is what? Vitamin A prophylaxis, you are giving something very specifically. Okay, so what is this vitamin A prophylaxis? Vitamin A prophylaxis means what? You are doing very specifically. Okay, what does it mean? Vitamin A prophylaxis comes in which one? Specific protection, not primordial prevention. Kushi, it's not primordial. Primordial means before risk factors. Before risk factors. What is the question here? This is prophylaxis. You are doing very specifically. Okay, it's like vaccination. Okay, this comes in primary prevention. What is this? Specific protection. Specific protection. Which of the following is a measure of burden of disease in a defined population and effectiveness of intervention? I think I told you today. Which one indicates burden of the disease? Two things will say burden of disease. Okay, two things will say burden of disease. One is proportional mortality rate. Second one is DALI. Okay, two things. One is proportional mortality rate. Second one is DALI. That talks about, Okay, burden of disease, guys. Burden of disease. Fine, fine. Excellent, excellent answer. Third question. Specificity of a screening test is the ability of the test to detect what? Specificity of a screening test is the ability of the test to detect what? Specificity. Specificity. You are talking about specificity. Specificity is ability of the test to detect. Sensitivity, I said, is the ability of the test to detect true positives. Specificity, what is the ability? Yes. Sensitivity is true positives. Specificity is what? True negatives. True negatives. We are talking only true positives and true negatives, guys. Sensitivity is true positives. Okay, today also we have discussed sensitivity is true positives. Okay. Specificity is, that is true negatives, guys. Negatives. Okay, fine. True negatives. True negatives. What is Sullivan's index? What is Sullivan's index? Okay, what is Sullivan's index? Sullivan's index we have discussed today. Today also in this class I have included it. Okay, what is Sullivan's index? Sullivan's index is what is Sullivan's index? Yes. Sullivan's index is measures life expectancy free of disability, guys. It includes life expectancy free of disability. That is Sullivan's index. Free of disability. Screening is which level of prevention, guys? Screening is which level of prevention? Screening of disease is which type of prevention? Is screening is which type of prevention? Any screening is what? Any screening is secondary level of prevention. Any screen. Fine, fine. All of you answering nicely. Any screening comes in secondary level of prevention. Any screening. Okay, pap smear or any screen. What is the reliability? We didn't discuss today, but what is reliability means what? So what is reliability? Reliability. What is reliability means what? Reliability of a test means what? Reliability means, okay, if you do it again and again, you should give the same results. What is reliability? Reliability means, okay, reliability also called as repeatability, also called as precision. Precision. If you do it again and again, it should give what? Same results. Okay, if you do it again and again. Okay, so if you do it again and again, it should give the same results. If in that particular person, if it is positive, if you do it again and again, it should be positive. That is reliability. Fine, fine. So all of you are answering nicely. For calculation of positive predictive value of a screening test, the denominator. I said the denominator for sensitivity is diseased people, specificity is non-diseased people. What is the denominator in positive predictive value is all are positives. Okay, so what is the denominator is, what is the formula for positive predictive value? Okay, so positive predictive value is true positives by true positives plus false positives. That means all are positives. Okay, answer is all are positives. True positives by true positives plus false positives. All are positives. What is this one? Okay, decrease in incidence of a disease to a level where it ceases to be a public health problem. These are university questions only. Okay, so surveillance means search for cases. Okay, so this is not surveillance. We already seen elimination, eradication. Surveillance means search for cases. Okay, so what is the answer here? The elimination means interruption of chain of transmission. Eradication means disease is no longer present. So what is this one? This is called as disease control. No, elimination. What did I say? Elimination means interruption of chain of transmission. Elimination means interruption of chain of transmission. Okay, we have seen. Eradication means extermination of infectious agent. Extermination of infectious agent. So this is disease control, guys. This is disease control. Choose the correct sequence of occurrence. Today we have seen this. Okay, so what is the correct sequence? Okay, what is the correct sequence? Disease, impairment, disability, and handicap. Okay, so what is the correct sequence? Yes, so we have seen it. Disease, first disease will come, then go for impairment, then disability, and finally it can go for handicap. Okay, handicap. Disease, first impairment. Impairment means, okay, it may be anatomical structure or physiological function. Disability means not able to do a normal activity. Handicap means what? Not able to fulfill the social role, guys. Tally. Tally indicates what? That we have discussed today also. What does DALI indicates? What? Disability adjusted life years. Okay, lost years of life due to what? DALI. What is DALI? Okay, we discuss it is years of life lost plus years of life lived with disability, guys. Both. Okay, it includes both, guys. Okay, so years of life lost plus how much year they lived with disability. Both will come. That is DALI, guys. That is DALI. Both will come. All of the following involve two-way communication except you can ask questions, you can discuss. Okay, most likely if it's a very good class you can ask that also, but this is a common one. Okay, common one. Okay, so lecture is what? Lecture is more of yes. Okay, one-way communication. This is more of the people are changing now. Okay, didactic method. Okay, more of one-way communication. Okay, more of one-way communication. All of the following are approaches of health education except this. Okay, so we have seen four approaches we have seen. Okay, which among them is not an approach, guys? Which among them is not an approach? Service approach, regulatory approach, health education approach, mass media. Okay, so the answer here is mass media. What is the fourth one? The fourth one is primary care approach. That's the best one. That's the best one. Okay, fine. Primary care approach. This is a primary care approach. Okay, that is the best one. The following are mass methods in health education except. The following are mass methods. Okay, others can also answer, guys. Okay, try to answer. Okay, the following are mass methods. Okay, all of you, the Kushi, Kumaran, Harini, all of you are answering nicely. Okay, others can also answer. Yes. The following are methods, mass methods of approach in health education except. Which one is not? Newspaper can reach, folk media can reach, internet. What is demonstration? Demonstration comes in group approach. Demonstration comes in group approach. Okay, demonstration comes in group approach. Remaining are mass one. Demonstration group approach. Fine. Making wearing seat belt compulsory while driving a car is what approach in health education? Okay, so making wearing a seat belt compulsory while driving a car is what approach in health education? Okay, which approach? Which approach is this? Okay, we are forcing people to do it. Okay, we are forcing people to do it. What is this? This is a regulatory approach. Regulatory approach. We are forcing. Okay, we are forcing people to do it, guys. Okay, this is regulatory approach. Okay, fine. So that's all for today. So hope you learned something. We will see in the next week, guys. Okay, we'll see in the next week. So yesterday and today we have completed certain topics. 6 more classes are there. Okay, we'll see in the next week, guys. Okay, thanks for listening. We'll see in the next class, guys. Next class. Notes will be uploaded in the Telegram channel, guys. You can find it in the link. Notes will be uploaded in Telegram channel. Okay. Thanks for listening, guys. Thank you.